My name is Kim Zapor. I'm a registered nurse at the University of Michigan, and I'm going to be talking today about cancer resources in the community. In particular, I'm going to be talking about screening and financial resources for those that are uninsured or underinsured. And I'm also going to be talking about some cancer information resources that are very reliable out on the web for you. So to give you a little bit of background about myself, I've been a nurse for about 35 years. Most of my career has been in cancer. I currently work with a service called the Cancer Answer Line, and it's staffed by registered nurses in oncology care. And it's a free community service, so you do not have to be a patient at the University of Michigan to access our service. We take calls from all over the state and even out of state. You can call us at our toll-free number there on the screen or email us. It is an anonymous service, so you don't have to provide any personal information if you choose not to. But our role is to answer any questions related to cancer, whether it's prevention, signs and symptoms, treatment options, clinical trials, support services, financial resources. So if we don't have the answer, we certainly try to find out for you and get you navigated in the right direction. So that's a great free resource there. I am going to start with screening resources. And once again, this is going to be for uninsured or underinsured patients. So we know that cancer screening is really important. Cancer is about 50 different diseases, and we screen for about 6 of them. And we know that screening and catching cancer early lowers the mortality rate significantly. So I'm going to start with a program through the Michigan Department of Health and Human Services. It's called the Breast and Cervical Cancer Control Navigation Program. I know it's a big, long name, but they offer free screening for eligible women. And for cervical cancer, it's ages 21 to 64. And it's what we call co-testing. So it's a pap smear with an HPV test. As long as that's negative, they only have to do that like every 3 to 5 years now. Those guidelines have changed a little bit. And we know when we started screening for cervical cancer about 50, 60 years ago, it has lowered the death rate by 75%. So that just really is a testament to how important screening is for women. Cervical cancer used to be the #1 cancer that killed women 50, 60 years ago. The other free service is breast cancer screening. It's for women ages 40 to 64, and it's an annual mammogram. And once again, we know with screening with mammography, it's lowered the mortality rate by about 25%. So moving on to colorectal cancer screening. There is a great organization called the Colorectal Cancer Alliance, and they get grants every year. And they offer a couple different screening tools. One is called the FIT kit, and that stands for fecal immunochemical testing. And basically what it does is it can look at any blood in the stool that's not visible to the naked eye. So they send out free kits to people. Another option they have, if somebody is having symptoms and such as abdominal pain, blood in the stool, they will help coordinate a colonoscopy, a free or low-cost colonoscopy for patients. They're really wonderful. I've sent a lot of patients to this organization. They have navigators there. So the navigator will help find one in their geographic area. They will also help them coordinate that appointment, and then they also follow up afterwards. So that's a great organization to reach out to. So coming up in May is Skin Cancer Awareness Month. We're getting into the warm weather, and skin cancer is the #1 cancer in the United States. And there are certain individuals that are at higher risk, those that have had a lot of unprotected time in the sun, and many of us did, especially in our childhood, and also fair-skinned people, so people with blonde hair, blue eyes, freckles, they're at higher risk just because they don't have what we call enough melanin in the skin. So as we age, we should be getting a clinical skin exam annually. Every May, the American Academy of Dermatology, they have this great program. It's called Spot Me, and they collaborate with doctors and health systems all across the country to provide free skin cancer screening. Last year it was on hold due to COVID, and I'm hoping this year they will be able to have a few sites open. I know as we are starting to get everybody vaccinated, I'm hoping that will occur. And then lung cancer screening. is the next thing. So individuals, not everybody qualifies for lung cancer screening, but if you do, so it's for former and current smokers, and those individuals that have smoked 1 pack per day for 20 years or more, and it's for individuals 50 to 80 years of age. And what it is, this is a low dose CAT scan, so it doesn't have a lot of radiation in it. We know that CAT scans are much more sensitive at detecting tumors, small tumors in the lung. So we have decreased the mortality rate with screening. We started doing this about 20 years ago. We did a large scale study and it really showed the benefit, but it's lowered the mortality rate by about 20% when we can catch lung cancer in a very early stage. So Radiology Assist, I have their website up there, will help you find a low cost CT scan in your area. If you need lung or want a lung cancer screening, you can certainly reach out to them. And then last but not least, prostate cancer screening. So September is Prostate Cancer Awareness Month, and a lot of organizations and health systems will offer free prostate cancer screening. So prostate cancer is very common in men, especially as they get older. About 1 in 6 men will be diagnosed with prostate cancer. We like to start screening men starting at the age of 50, and it's the PSA test along with a digital rectal exam. So currently, I only found one prostate cancer screening in Michigan. It's at McLaren and Bay City. I put their contact information up there. If you live in that area and you don't have insurance, you could certainly reach out to them. I'm hoping as we get through the summer, more health systems will be offering that. I know St. Joseph Mercy Health around the state, they have many hospitals around the state. They oftentimes will offer that screening. So that's another free screening. Once again, if you have health insurance, your health insurance should cover all of these screenings. But if you don't have health insurance, these are some organizations that you can reach out to. And then I wanted to talk a little bit about some free clinics out there. The free clinic directory at the website there has a list of free medical and dental clinics throughout the state. It goes by county, so you can just click on your county. So we know that obviously medical health is important, but also dental health is very important. We know that people that have poor dental health, it negatively impacts their physical health. So that's really important to remember. Another organization that I really, really like is the Patient Advocate Foundation. This was started in the early 90s. And they don't just help uninsured people, they help people that are insured that maybe have high deductibles or high copays. And they have case managers there that are assigned to your case. And their role is to navigate the insurance system. So sometimes maybe a certain service or treatment was denied to a patient by an insurance company, and those case managers will help navigate that and kind of get through that red tape for you. They're excellent at doing that. They also have this copay assistance program. So if you're on a medication and the copay is just too expensive, and sometimes it is, it can be sometimes thousands of dollars a month, and most people cannot afford that. So they can help you navigate that too. A lot of pharmaceutical companies have support programs and they're very well aware of that and can help you with that. So I love that organization. I recently learned a fund finder from a social worker who gave a talk, and she really sang their praises. So they have funds for all different diseases, not just cancer. You can go to their website, you just have to register, it's free to do that, but you can go through and see what funds are available, and that can help offset some medical costs as well. Healthcare Finder through the government, they have a list of plans available through the marketplace. And I also think it's helpful if you are in a health system and they have a financial counselor. I know here at Michigan Medicine, we have financial counselors, and they oftentimes, they're really instrumental in helping patients find a plan that's meets their financial ability, but also meets their personal needs of the healthcare that they need. So always tap into any social workers or financial counselors at a health system that you're connected with. And then last but not least, I do like the Michigan Cancer Consortium. I just put their website up here, but they have a patient resource section and it's excellent. They have a multitude of resources. They also post any free screenings or things going on for patients, but it is a great organization. They kind of have the healthcare side of it, but they also have the patient side of it for patients. So That's a great organization. So I wanted to touch briefly on cancer information resources. If you or a loved one has been diagnosed with cancer, I think the first thing we do is we go on the internet, which is not necessarily a bad thing, but there's a lot of misinformation and bad information. And I talk to a lot of patients who have read something that's not accurate at all. So I wanted to put some good websites up there that are very reliable. They're written by physicians and nurses, and it's very evidence-based. And it's the American Cancer Society, the National Cancer Institute, and the National Comprehensive Cancer Network. So those are three organizations that you could certainly reach out to for very reliable information. So once again, if you have any questions about this presentation, or if you've been diagnosed with cancer, you don't know where to start, you're overwhelmed, feel free to contact us at the Cancer Answer Line. We're more than happy to help you and answer your questions and get you pointed in the right direction. So I just want everybody to know that there certainly is help out there for you. It's been a privilege to be here with you today. I really appreciate your time. Thank you.
Hello, welcome to a discussion on meaningful solutions addressing mental health and suicide. This is actually the second part in this series focused on wellness, supported by the Farmers After Hours program. My name is Addie Weaver. I am a professor at the School of Social Work at the University of Michigan, and I'm really happy to be here with you all to have this conversation. So to get us started, I was hoping that we could, I could share a little bit with you about why this topic is so important to me. Those of you who may have seen the first part of this series, this is a bit of a review, so I apologize, but I wanted to make sure that new folks will get a sense of who I am and why I'm passionate about this topic. So I grew up in a rural area in Pennsylvania and saw firsthand through both personal and professional work experiences the lack of mental health services available in rural areas and how that negatively impact folks in my friends and family network and folks that I was serving through my different roles as a social worker. So as I moved into doing more research, I really wanted to try to make an impact in terms of being able to improve access to research-supported mental health treatment in ways that are acceptable and accessible for people living in rural areas. So some of this information may not be news to you all since you're living in rural places and may, like I did living in rural places, see some of this firsthand. But I wanted to share some of what I find are some pretty striking statistics about the lack of mental health care that's available to folks in general, and then more specifically, challenges for rural communities. So in general, we see that over half of US adults who are living with a mental health need actually don't receive treatment. And on average, there are 11 years between someone first experiencing a mental health problem and when they first reach out and make contact with any type of treatment provider. And finally, we know that there are many mental health treatments that have been developed and studied and found to really help people, but it's taking at least 20 years on average for those treatments to become available in what would be kind of the routine practice settings where you and I would go to get care in our communities in the United States. So we can just see overall, this is a really big public health problem in our country. And in rural areas, it's even harder to get mental health care. So as we talked about in our first session together, rural residents across the United States are experiencing mental health needs at rates similar to people in urban areas. So when we think about depression and anxiety, we're seeing really similar rates. And then when we look at some other concerns like suicide, we actually see much higher rates in rural areas. However, folks in rural communities are less likely to receive any type of mental health treatment to help support them as they're experiencing these mental health needs and challenges. And so why is that? Well, there's kind of three key drivers of some of these access disparities that we see around mental health care. Probably the biggest one is the availability, or in rural areas, the lack of available mental health professionals who can provide appropriate care. So, as you can see here, 60% of rural counties throughout the United States don't have a social worker, psychologist, or psychiatrist practicing in the area. So this is a big problem. And as many of you know, for any type of specialty care in rural areas, it often puts so much burden on those of us living in these communities to, have to drive far distances to be able to access somebody being able to provide specialty care, whether it's for a specialty health condition or mental health condition, because we see in a lot of areas we just don't have local folks on the ground to be able to fill these needs in our rural communities. Aside from that, we also see access challenges. So we mentioned these a little bit a few minutes ago. The transportation piece is a really big one, and the travel burden. So to be able to get to care, oftentimes you need to have reliable transportation and be able to have the flexibility in your schedule to potentially drive an hour and a half each way to get to a specialty care provider. And for a lot of us, that's just not something that we can do, especially not on a regular basis. And with mental health treatment, oftentimes we see that, our mental health providers may want to see us once a week, at least for a while, to get things started. And that becomes really difficult. Of course, with many types of care, and with mental health care, cost becomes a potential burden as well. And in rural communities specifically, insurance status. So we know that in rural areas, folks are more likely to be underinsured, uninsured, or not have mental health coverage that adequately meets mental health needs for care. And even with the changes made as part of the Affordable Care Act, we're still seeing that there's this disconnect in rural places, and that insurance status remains a barrier. Finally, we see acceptability challenges. So, the mental health treatments that are often developed and tested in, research settings or labs, universities, they're typically designed for people living in urban areas. People that are, higher income status, high educational attainment levels. And a lot of times what happens is we just kind of drop these treatments into other places, and it doesn't always fit with what people want or need from care. And we see this a lot in rural areas as well, where we see these urban models kind of transplanted to rural settings without any attention to whether this is actually what people in rural areas want or need to help address their mental health needs. And so when we think about rural communities in general, and again, you all have much more expertise in this than I do from, being boots on the ground in these communities. But what my experiences and what the research would tell us kind of more generally is that in rural communities, there's a preference for getting help for mental health concerns from friends and family, and from informal providers like clergy. And also that there are concerns about the lack of anonymity that comes along with living in a rural place. So, there's no question when we're living in rural areas, we're spread out physically. So geographically, we can be more isolated from our neighbors. But in terms of social networks, you all know this, people know everybody and know what's going on with everybody. And so if your car is parked at the mental health treatment center, maybe you'll walk in and your cousin's really good friend is that person at the front desk checking you in. Or maybe three people are driving by on their way to Walmart and they see your car in the parking lot. And then, people are asking you or asking your spouse, hey, what's going on? We saw your car there, And so that's a concern because people don't always want to be sharing all of their personal business with the community. And so that's a concern in rural areas that is real and hasn't been adequately addressed in my view. So these are some of those drivers that are kind of contributing to what we're seeing with the lack of available mental health treatment, specifically in rural communities. So what can we do if we ourselves or someone that we care about is experiencing some mental health needs or challenges? So there's kind of three what I would call central routes that we can think about in rural communities where we can seek help and get support. So the first is primary care. And so many of us may already be connected with a primary care provider in our community. And maybe we don't always think of primary care providers as someone that we would go to if we are, having a challenge with, our mental health. We might think of our primary care provider as someone we'd go to if we were having, maybe some issues with our blood pressure or, a back problem. But our primary care providers are really frontline mental health providers as well, especially in rural communities. And so, I would encourage you not to hesitate at all to bring up mental health concerns to your primary care providers and really see them as a partner in being able to help address any type of concern that comes up, whether it's you're feeling down, you're feeling anxious, and also you may be able to encourage or help someone else connect with their primary care provider if you're seeing someone in your life experiencing some challenges or symptoms that might indicate that getting some support for mental health could be helpful and beneficial for that person. Also, most communities have a community mental health center. Now, often in rural communities, there will be one community mental health center per county. And we know that this is not often ideal because rural counties can be very large. So we can still experience challenges with getting there. But the community mental health organization in your county is a place that can provide support and also can be particularly relevant if there is a crisis situation that you or someone that you care about is experiencing. There are folks that are able to help through kind of those acute crisis needs. When it comes to kind of more general mental health needs, if you're feeling down or feeling anxious and we're wanting to get some regular help, community mental health isn't always able to help with that, in part because they have funding constraints that really kind of lead them to prioritize serving folks who are experiencing severe and persistent mental health needs. And so that's just something to be aware of, but definitely community mental health is a great crisis resource and can sometimes be the right fit for other mental health needs as well. As many of you may also know, and especially given our current realities with the COVID pandemic, telehealth care has really been growing across all areas of medicine, including mental health. So we're seeing a lot more availability of connecting with a provider, virtually through video conference. And so a lot of providers are now offering video visits. And so this is a way that we can improve access to care. And also in rural communities, we need to be cognizant that many of us don't have access to high-speed internet that facilitates our ability to connect through video conference or do these video visits. So while I do think that there's promise for telehealth care for mental health needs, I don't think in rural areas we're quite there yet to have that be, a viable reality for everyone who may need care, but definitely something, to have on your radar, as it is something that can help reduce that, travel burden to actually get to a physical location. And there are some providers, particularly the Department of Veteran Affairs that have been able to offer quite robust telehealth care through their health systems. And so, just wanted to begin the conversation about that because while I think it's not as widely accessible now as it could be, I do see a lot of promise in the future for continued telehealth options. Additionally, I did want to bring up some free web-based and mobile apps. Again, I know we just talked about some technology limitations. Again, totally aware of those. And also, if you do have internet access or a smartphone, there are some ways that you may be able to get some access to some supports that could be helpful. So here you'll see that there's 3 apps that you can download on your phone that are research supported. They're called Headspace, Mood Tools, and Mood Path. And all of them provide some strategies and tools to help with stress, low mood, anxiety, and just kind of general emotional health and kind of awareness of your mental health. Also, there are a couple free online resources specifically for depression. The University of Michigan Depression Center has built a very nice comprehensive online toolkit where you could assess your symptoms, get a sense of what available resources might be, and have some access to self-help resources as well. And also, the State of Michigan Department of Health and Human Services has been sponsoring mental wellness webinars that range across a variety of different topics from, mental health, if you have faced, unemployment during this time, to the mental health of, children and adolescents. So if there's kids in your life that you're concerned about, there's a webinar that may be of interest to you. So lots of different topics there that you could take a look at and, just get some helpful, again, information and resources through those. So just wanted to make sure to share those as part of our discussion here today. Additionally, there are help and crisis lines that I think it's important for all of us just to kind of have on our radar and know that they're there. Because, when none of us expect to face a crisis with someone that we care about or ourselves. But when it happens, if we're a little bit more prepared and have some resources in mind, it can really help during a super stressful time. So one thing that I wanted to share is that due to the COVID pandemic, the state of Michigan has actually developed a Stay Well counseling resource. You can call the COVID-19 hotline. The number is here on the slide, and then press 8 and be connected to a counselor. It's free and completely confidential. So a great resource if it would be helpful to, talk to someone in person and get some support. There's also a text crisis line specific to the state of Michigan. And so you can see texting the keyword restore to 741-741 will put you in text communication with someone who can provide support to you in a time of crisis. And that text line is available 24/7. It's always staffed with a real person that will respond to you if needed. Many of you may already be familiar with Michigan 211. So if you call 211, you can be linked with needed services around specific areas of need. And that again is open 24/7. I also wanted to share specifically the National Suicide Prevention Lifeline. You can see there's a toll-free number there. Again, you can get free and confidential support that's available 24/7. There's also the National Crisis Text Line. It works very similarly to the Michigan Crisis Text Line. You text the keyword home to 741-741 and get free support anytime, day or night, from a real person that will engage with you via text. And this can be, if you're having challenges with sadness, with anxiety, if you have a child that's having, issues with school, any type of those situations that rise to that crisis level can be addressed through this resource. So wanted to make sure that we touched on those during our time together today. And now I wanted to move us a little bit to some other ways that we can think about building capacity within rural communities to help support mental health and really focusing in on informal systems of care. So a lot of times, as we talked about before, we just don't have access to, what are viewed as like formal mental health professionals. But we have a lot of folks in our communities that we engage with who really are able to provide some support. And I think there's a lot of opportunities within our rural spaces to build on that capacity and really just reinforce engagement with people that we might be more comfortable with or may already be going to talk with when we're having a mental health need or challenge. So I think a really important potential source of support when we are experiencing a mental health need is clergy. So if we're connected to a faith community, to a church, reaching out to our clergy can offer a really important way to get some support. Clergy often have training in pastoral counseling and are able to, help us navigate some challenging situations in our lives as well. Also, especially if we have young people in our lives that we care about, working with the schools. There have been a lot of efforts within the schools to be able to provide more support for youth who are experiencing mental health needs. There's actually been a pretty large scale statewide program through a partnership with the University of Michigan called TRAILS. That has been training professionals in schools to be able to help kids with their mental health needs by delivering one of the evidence-based treatments called cognitive behavioral therapy that can help a lot with depression and anxiety and other needs that kids have. Also, family and friends. So sometimes even just naming that we're having a mental health need, or we're having some, maybe feelings of sadness, or we're having a higher level of anxiety and it's starting to make some things difficult for us, that can be hard to talk about. It can be hard to share that even with, the people closest to us. But family and friends can be, a great resource to just open up that conversation and get some support from. And, you as a family member and a friend can be a great support and resource to others in the community. And so if you're noticing that someone maybe hasn't quite been themselves, maybe they seem down, maybe, somebody that always would, show up to, the poker game on Saturday has stopped coming, or someone that was in the church group isn't showing up, and it's been a few weeks, just kind of reaching out and checking in and seeing if they're okay can make a really big difference, and maybe be the first, kind of opportunity for them to share what they've been going through. And you may be able to help connect them with other resources that, make sense for them and work for them. Additionally, as a family member and a friend, we talked about in our first session the high rates of rural suicide. And so, not being afraid also to have some, hard conversations about, the issue of suicide. And, also what can we do as friends and family members if someone we care about is, disclosing that they're having thoughts of, ending their life. And of course, we would want to connect people to crisis resources. And also, there may be some things that we can do even within our own households if we're worried about somebody. And one of those things is to reduce access to means. So it may be that you're going to think about ways that you can securely store pills or get special lids for pills that are, it's that kind of leveling up from those childproof lids so that people really can't get into them. Maybe it's during the time that someone is experiencing this, kind of feeling like they may want to end their life, making sure your weapons are locked up, that your ammo is locked up, maybe considering a trigger lock. Anything that you can do to put some time between somebody wanting to take action to end their life and physically taking that action can make a really big difference. So again, just wanted to share some things that as family and friends, we can do to support each other and the mental health of those we care about in our rural communities. Finally, community gatekeepers can be an important, again, resource for help. And gatekeepers might look different in each and every community. It may be law enforcement in some communities. It may be, agricultural programs in other communities. For youth, it may be 4-H acts as a community gatekeeper. It may be folks more involved in local government or township supervisor. But folks who are coming into contact with people in the community have a lot of local knowledge and influence in that community who can help in a number of ways, including public awareness about mental health needs, getting the word out about different resources, as well as being able to potentially provide support in some innovative ways themselves. So I actually think that that's an underutilized strategy in rural communities that could really help advance our ability to provide support for mental health needs. I also wanted to share some innovations that have come out of some community university partnerships that I specifically have been involved in and am really excited about. And so wanted to just share what some of these look like just as some models of what's possible in rural communities and what's possible through community university partnership. So for about the last 8 years, I've been working with rural communities in the Southeast Michigan area to think about ways that we can improve access for depression treatment. And in the communities that I was working with, what came up as kind of that constant theme was folks really reaching out to their clergy for support for mental health needs, specifically for, times when they were feeling sad or down. And so, I began working with some clergy and we developed really strong collaboration and we developed a program called Raising Our Spirits Together. It's based on an evidence-based depression treatment, but really tailored and developed specifically in collaboration with rural community members and specifically rural clergy, so that it's very relevant for the rural context and for being delivered by clergy. And so it's an 8-session treatment where we really kind of focused on having it run very similarly to any group program that you'd go to at your church. So I don't know if any of you, have church communities where you've gone through, maybe a Bible study program on a specific book of the Bible, or maybe a program focused on another aspect of wellness. Our clergy partners really, took the lead in developing this program in a way that was very natural to them and very much was consistent with the group programs typically offered in the church. And so we have amazing clergy partnering with us who deliver this intervention. And because of COVID, we've actually had to deliver it virtually. So our intention was for folks to come together in churches to go through this program But now with COVID, everybody joins Zoom. The clergy share their screen, just like I'm sharing my screen with you right now, and folks go through the program together. The program is computer assisted, so the clergy shows content that features actually a character. So you almost see these kind of episodes of a character named Billy, who was depressed last year, and got some help from cognitive behavioral therapy. And so we see sort of what was going on in her life and how she was able to use her mental health treatment to make some changes. Not everything always goes well for Billy, just like not everything always goes well for any of us. So we try to, make it a little bit more realistic and not all sunshine and roses. And so this project is something that we're super excited about, and is going on right now. We're currently serving folks in Hillsdale, Lenawee, Branch, Calhoun, and Jackson counties through this program. And so if you are at all interested in more information, please feel free to reach out to me, and I'd be happy to talk with you more about raising our spirits together, and what we're currently doing in rural communities and with our rural clergy partners around, to support this project. Similarly, we have partnered with rural WIC clinics to offer a depression treatment specifically for pregnant and postpartum women who are receiving WIC services in rural Michigan. In fact, it's really interesting. Postpartum women living in rural areas are about twice as likely as postpartum women living in urban areas to experience postpartum depression. And so this is a really big gap, yet 50% of women experiencing postpartum depression don't even get it detected. So there's a really big issue here. And so, we're really interested in talking with rural communities in Michigan again about, how could we potentially work together, have the community and the university equal partners in thinking of ways to address this. And so we're hearing from folks that the WIC clinic might be a good place to do this. They're asking about a lot of kind of health needs about moms and babies. The families are prioritizing getting to their WIC visits because they're relying on those resources to meet basic needs, because the WIC program provides food vouchers. So we were able to partner with the Lenawee County WIC Clinic as our first partner to build together a depression treatment called Moms and Babies Feeling Better Together. And we've actually just started this project beginning on March 1st, where we're offering this program to women who screen positive for depression at the WIC Clinic. We're really excited about it. So far, we have about 18 women who are interested in the program, and about 5 women who've started the program. So again, this is very new, but I just wanted to share it with you, as an example of some innovative ways that it's possible for communities and universities to work together to build capacity in rural areas in a way that, works for rural folks and works to build capacity within the existing service delivery system. So just some key takeaways. Again, this first bullet will not be new to you at all. Rural residents face substantial barriers to getting mental health care. Some kind of key things to think about is that your primary care provider is really a first line resource that you can reach out to for any type of mental health challenge or need. There are also robust phone-based resources for counseling and crisis support that are available that don't have some of the limitations of some other more sophisticated tech-based resources. Additionally, it seems that it's super important to begin thinking about solutions that focus on ways to build capacity within our rural communities. That these are really promising and actually require more attention. I think for decades, policymakers have just kind of been thinking about how can we increase the number of mental health professionals in rural areas, and we haven't seen the needle move. So what's currently happening or being tried is not working. And so we have to think a little bit differently and outside of the box around this issue. Again, there is great potential for tech-based solutions, but existing challenges around high-speed internet access, even smartphone use and reception are still real and cause, the currently available technology-based solutions not to be quite as viable in rural areas. I will also say to you all, being part of the agricultural community, you all have a very important voice in terms of your rural communities and kind of rural policy more broadly, where I think, if you all were so inclined to kind of, bring these issues to the table or think about ways that might be helpful or promising to build capacity in your community, that there'd be an opportunity there to get some important conversations going with people in your local governments and otherwise to think out some ways that we can better support folks in rural areas who are experiencing mental health needs. So thank you very much. Again, I really appreciated the opportunity to engage with you all and really look forward to having further conversation at our session on May 5th. Thank you. Bye.